Now, though, just coming up to 8:30, the spiralling cost of living is hitting the nation's mental well-being as well as their financial well-being. A quarter of people say their mental health has declined due to the current financial situation. That's according to an exclusive YouGov poll commissioned for this programme.
Plus, this morning, a charity I founded and am chair of, the Money and Mental Health Policy Institute, is warning about the dread people feel opening letters from energy companies. We've had changes for financial letters, but the energy company letters can be a trigger for anxiety and panic unnecessarily. Joining us now is Rob Smale, who says his mental health is being impacted as a result of financial worries. Rob, good morning, and thank you so much for coming. Now, if you don't mind me setting the scene first, mental health issues are not a new thing for you, are they?
Not at all.
Can we find out what's the situation?
I have a chronic mental health problem that was made about 7 years ago, had a huge crisis, was in and out of hospital, went from a 5-bedroom home to living out of a suitcase, ended up in a housing association flat and living on benefits.
Yeah, and it's worth me saying there is a marriage made in hell between mental health problems and money problems. You're 3.5 times more likely to be in problem debt if you have a mental health condition than everybody else. So you're far from being alone in this situation.
I did some work for my local mental health trust about suicide prevention. And while I was doing the research, one of the biggest groups that commit suicide are 35 to 55-year-old men. The two major causes for them committing suicide are relationship and money. And their relationships often go wrong because the money's gone wrong.
Well, I mean, the stats are horrendous. It's thought in England alone, 400,000 people contemplate taking their own lives due to financial problems, and 100,000 people attempt it, which, of course, means that we cannot isolate the cost of living crisis from the mental health crisis. And we already have a mental health crisis as a hangover from the pandemic. But in your situation, Rob, how's the cost of living crisis affecting your mental health?
Well, maybe I need to be practical first. 12 months ago, a week's shopping cost me £25 to £30. This last week, I went shopping, it was £40, and I haven't yet bought any meat or fish.
Wow.
So this idea that inflation's at 4% or 6% or 8% is nonsense if you're at the bottom end of the income scale.
Yeah, inflation is regressive.
Yeah.
The people with the lowest income feel it the most.
So I have two sets of things that go on. One, the shame and guilt about being in that position. And the other is, how the hell am I going to get enough food in my fridge?
We've been talking this morning about people who've actually cut down on meals, even going for...
one a day.
Is that what you're down to?
One a day? When do you eat? You don't eat at all the rest of the time?
I eat in the evening because I cook. I make sure I cook because one of the things about mental health issues is that you'll end up... I mean, I've put on 1.5 stone because of bad eating during lockdown.
What will you cook for yourself in the evening? If you're only eating one meal a day, because that's all you can afford, what does that meal
I've got a slow cooker,
right.
So whatever I can get at the butcheries on the discount ends up in my slow cooker, and then that can make me 3 or 4 meals.
So you're making a stew, effectively, which you can then extend over a couple of days.
Snacks during the rest of the day? Anything?
I may have toast, but only if I've got bread off at the end of the day.
And what is your income at the moment? Where's that coming
from? I'm on ESA and PIP.
Right. So you're on legacy benefits?
Yeah.
And I presume as you're not working, we heard the announcement today that millions of people are to be shifted onto universal credit. And in your situation, my assumption is you will get less on universal credit.
Yeah, because the government promised they would have transition payments, but those aren't guaranteed over any particular period of time. So if, like me, you've got a chronic condition, which means you get what they call the disability premium on ESA, that falls away.
ESA is
employment support allowance. It was the old legacy benefit.
Now, because I know some people find mental health difficult, and we have you in front of us. You talk very well, you're articulate, you're professional. So some people go, well, what's wrong with him?
All right, so here's a really...
And I don't mean...
No, I don't mean... No, because it is difficult, because the stereotypes around people like me are that we're sitting in the corner falling apart the whole time. But you were talking about the letters.
Yeah.
Because of the particular way that my mental health affects me, under stress, I can't read. I can't understand what I'm looking at.
You get a kind of...
It's like it's called form blindness. It's almost like dyslexia for letters.
And if it comes with a big red box around it saying demand to pay, then you get a form blindness, which means that you can't process that information.
No.
And of course, if you don't process it...
You get into trouble.
Yeah.
Just to read something that reflects that, somebody else talking about this. When mentally unwell, one of the first things to go is the ability to communicate rationally and the loss of language, grammar, syntax. Our brains are broken. Unexpected approaches such as unsolicited emails, letters and text cause us great anxiety and can actually aggravate our mental health, even to the point of suicide. To our unwell selves, letters are too frightening and potentially harmful and remain unopened or unread unless we have a trusted other to open them on our behalf. Demanding, patronising and dictatorial language in communications with vulnerable adults, whether face-to-face or in other forms, has caused me great anguish and distress. And this is why we're calling on energy firms to change the language of their letters, to signal help before you signal aggression, much as we successfully did with financial companies last year.
Yeah, and you also helped get the breathing space in, which was another huge thing. But when it comes to the letters specifically, I had a support worker when I first came out, the last time I came out of hospital, and he said one of the things that he does is he asks people to bring their mail with them.
Yeah.
Because it isn't just that you can't read the form, you get to the point where you can't open them. And of course, if you can't open them, even if there's a helpline number and even if there's you won't see it.
And is it panic or is it just...
No, it's worse, it's far worse. It's panic is an understatement. Because you get this gnawing feeling that no matter what's in that letter, it's going to be bad. It's, we call it black and white thinking and awfulizing. So it is
catastrophising.
Catastrophising, yep. Yeah. The good example, however, is my housing association knows I have this problem. So every year when the statement comes with all of the charges and stuff, I can't work out what my service charge will be. But when I phone them, they will talk me through it.
Do you know what? Even making that phone call is stressful.
Well, when I'm not very well at all, I can't do it, in which case I sit there and wait for that thing to come off my bank account.
Do you know what I'm just thinking now? How brave you are to come on here and talk about this.
Totally right.
Thank you so much.
You're welcome. Somebody's got to talk about the reality.
Can I just talk about... We're about to speak to the government minister who's joining us this morning, but the issue of benefits not rising in line with inflation is a massive issue for people. Is that something that
It's huge, and I need to just flag something.
Yes.
On Friday, the Treasury briefed that the reason they couldn't change benefits is because the system wouldn't allow them. It would only once a year. They've known that since 2 years ago when they didn't give an increase to legacy benefit holders. So they've had 2 years to sort that problem out. They managed to get furlough up and running, but they can't sort out an IT problem.
There is also we can't increase lots of costs or payments in line with inflation because that actually fuels inflation.
It does if you're a supply-side economist who believes in monetarism as the best way of controlling everything. So it's socialism for the rich and their companies and capitalism for the poor.
Well, that's summed up your feeling about it very clearly. Look, Rob, I completely endorse what Martin has said. It is incredibly brave to speak about these issues openly. But what you have done in your incredibly articulate way is shine a light on something that a lot of people, firstly, don't understand because they don't experience, but also might not want to focus on. So thank you very much indeed.
And that anybody can be suffering mental health problems. And what you see on the surface and the presentation does not necessarily mean you know what's going on inside.
Absolutely right. So if you are affected by those issues, there is advice and support, itv.com/helplines, and you would hope from the government as well.